Hello, everyone. We'll get started in just a couple minutes. I'm going to give everybody about 2 more minutes to get logged on. If you'd like, you can put your name in the chat box so I know who's here. Hi, Tate. Okay, I'll go ahead and get started. And if anyone joins us later, this meeting is being recorded and you'll get a link with the recording after the workshop. So for those of you that don't know me, my name is Ailar and I'm the functional nutritionist at Pacific Integrative Psychiatry. This is the Mind Your Gut workshop. We host these once a month and today's topic is Irritable Bowel Syndrome or IBS. So here's a little bit of information of what you can expect for today's workshop. So I'll be hosting a live session every 4th Wednesday of the month at 6 p.m. Pacific Standard Time over Zoom. Today's topic, as you already know, is IBS or Irritable Bowel Syndrome. Participation is welcomed and definitely encouraged if you feel comfortable. I even invite you to turn on your camera or your microphone when you're asking questions. At the end of the workshop, I'll open it up to a Q&A if anyone has any questions relating to the topic of IBS or gut health in general. A few rules to keep in mind. Please listen when others are speaking. Respect each other's privacy, especially if someone shares something that is a bit more confidential or private, and try to put away any distractions if possible. Here's an outline of what today's workshop will look like. So first, we'll cover what is IBS and the different subtypes. Then we'll talk about the common root causes of IBS, certain risk factors that may make individuals more prone to developing IBS. We'll talk about how IBS is diagnosed, how IBS and mental health are related and really connected. And then we'll talk about certain treatment approaches to IBS. And then at the end, we'll move on to the Q&A. Okay, and before we get started, we're going to do a quick mindful check-in. If you haven't done these workshops before, you may not be familiar, but basically I'll ask you a couple questions so that you can check in with your body and especially your gut to see how you're feeling right now and how you were feeling throughout the day. I encourage you to share your answers if you feel comfortable. You can either put them in the chat box or you can use the raise your hand icon and I can call on you to share. So the first question is, how is your gut feeling today? You can even put your hand over your gut or your belly or your stomach and just see how is your gut feeling? How was your digestion today? Did you have any bowel movements? Did you not have any bowel movements? Did you experience any constipation, bloating, abdominal pain, anything like that? Has anyone heard of IBS or has anyone been diagnosed with IBS? And you can share that if you feel comfortable. And then lastly, how do you believe your mental health impacts your digestion or your gut health, and vice versa? How do you think your gut health affects your mental health? So if anyone feels comfortable, I invite you to either share in the chat box or maybe say out loud by turning on your audio any response to these questions. So has anyone heard of IBS? You can do like a thumbs up or a thumbs down if you've never heard of IBS or if you're not familiar with the term. Okay, so sounds like Tage has not heard of it. Vanna is definitely heard of it and is familiar. Okay, good. So we have a little bit of both, so that's great. Some people are familiar, some people not so familiar, and we'll cover in depth a bit more about IBS. And then at the end, if there's any remaining questions, I will definitely answer those. All right, and I just want to do a quick review of why gut health is so important, and some of you may have heard this in a previous workshop, but if you don't know already, the gut is really important for producing certain hormones and neurotransmitters. And this is really important for our brain health and our mental health. So as an example, the gut produces about 95% of the serotonin in the body. And the serotonin is a neurotransmitter that's responsible for our mood and our happiness. There's also 400 times more melatonin in the gut than the pineal gland of the brain. And melatonin is a hormone that's responsible for our sleep. The gut is also really important for proper digestion, right? So having a healthy bowel movement, preventing things like dysbiosis, leaky gut, and other digestive issues that we talked about a little bit, such as constipation, bloating, diarrhea, abdominal pain. The gut also plays a significant role in the immune system. So about 70% of your immune system is actually in the gut. And then lastly, the gut helps fight inflammation. And inflammation is often the root cause of several chronic conditions and metabolic imbalances. All right, so moving on now to what is IBS or irritable bowel syndrome. So this is a chronic condition with an unclear etiology. It's the most common gastrointestinal disorder in Western countries, and it affects about 15% of individuals in the United States. So that's really important. And it lets those of you that have IBS or have been diagnosed with IBS know that you're not alone. There are so many other people in the country that are also diagnosed with IBS and having the same symptoms. IBS is often characterized by altered bowel habits and usually abdominal pain. So now we'll look a little bit more at the different subtypes of IBS. So here you can see the three different subtypes of IBS, and there's a little graphic here that shows you a bit more about what each of these entail. So the first one is IBS-C, so irritable bowel syndrome with constipation. And this is usually when the stools are a bit hard or lumpy. So in the graph, you can see that your stool would be categorized as a type 1 or type 2. The second subtype is IBS-D, or irritable bowel syndrome with diarrhea. And in this category, your stool type would be either a 6 or 7, meaning that it is more loose and watery. And then there's a third subtype called IBS mixed, when it's a combination of constipation and diarrhea. So some days you might have a stool type 1, other days you may have a stool type 6. Some common signs of IBS include abdominal pain, bloating, distension, flatulence, diarrhea, and constipation. Now, some individuals have a combination of all of these symptoms, and some individuals only experience a few of them. Some of the most common causes of IBS are the following. So first, low-grade inflammation, which can be identified using certain types of testing, especially in a functional medicine setting. So a routine colonic biopsy often doesn't show identifiable signs of inflammation, but the inflammation can be expressed through inflammatory markers such as interleukin-1, and we can do blood tests or stool tests to look for these signs of inflammation. Another cause of IBS is altered gastrointestinal tract motility. And what this entails is significant delay in overall colonic transit or more rapid colonic transit. So, for example, an individual might have a really long time before they're able to have a bowel movement. It might take a long time for them to be able to go to the bathroom. Vice versa, another individual may have a more rapid bowel movement and even urgency having to go use the bathroom. IBS can also be caused by altered gastrointestinal tract microflora or dysbiosis. IBS patients often produce significantly more colonic hydrogen than healthy individuals. and they have higher concentration or different concentrations of certain bacteria and lower concentrations of other forms of bacteria. So, for example, IBS patients tend to typically have lower concentration of bifidobacteria and lactobacilli. Certain risk factors that can make individuals more prone to developing IBS include familial disposition. So this can cause alterations in the responsiveness of the central nervous system to stimuli. So we can see why the brain and the nervous system are so important in the development of IBS and in our digestion overall. Other risk factors include acute gastrointestinal infections. And infections tend to cause alterations in mucosal function and structure that leads to increased intestinal permeability. So, for example, if somebody has a bacterial infection in their GI tract, and then that bacteria gets treated with medication, their gastrointestinal tract and their gut is still going to be more sensitive and permeable after that infection has resolved. And that can cause more permeability and the individual to be more prone to developing these gastrointestinal issues. Also, a history of antibiotic use can induce alterations in the gastrointestinal tract microflora and or cause enhanced visceral sensitivity. So antibiotic use for treating infections in the case of a gastrointestinal infection or post-op. So a lot of individuals get exposed to antibiotics over the course of their lifetime. And lastly, but actually one of the most important risk factors for IBS is having a stressful or traumatic life event. So these events often precede the initial onset of IBS symptoms and cause symptoms of flare-ups. So a lot of IBS patients notice that under chronic stressful situations, their symptoms tend to come up and they tend to worsen. So let's talk a bit more about how IBS is diagnosed. And this can be a little bit tricky, but IBS is often diagnosed by exclusion of other chronic conditions. And this is what most healthcare practitioners will do. So, for example, the absence of other gastrointestinal pathology, such as lactose intolerance, celiac disease, Crohn's disease, or ulcerative colitis, which would be considered in the category of irritable bowel disease rather than syndrome. Diagnosis is also characterized by an average occurrence of at least one abdominal pain per week for a period of 3 months. So it tends to be a bit chronic and persistent, but other symptoms can also be present during this time, such as bloating, gas, constipation, diarrhea, or a combination of these, as we discussed. And the symptoms are often related to either changes in stool frequency or the stool appearance and form. So, for example, an individual might feel very constipated or not have a bowel movement for several days, or an individual might start to experience more loose stools as a sign of IBS. All right, so now we'll talk a bit more about the connection between irritable bowel syndrome and mental health. And this is why it's really important to revisit the gut-brain axis. So here in this photo, we can see how the gut and the brain are constantly communicating through these different pathways, such as our immune pathway, endocrine pathway, and neural pathway, through the circulation of our blood, through the vagus nerve. And as we talked about, the gut is producing several neurotransmitters and hormones that are signaling the brain. So in the case of IBS, if we're not able to properly absorb key nutrients from our diet, able to properly produce these neurotransmitters and hormones, it's really going to negatively affect our mental health. We also talked about how chronic stress is often an underlying cause or a main trigger of symptoms for IBS. Individuals with IBS often find themselves worrying about having to eat out or having to cancel plans due to a flare-up. And they experience increased social anxiety, maybe low self-esteem, poor body image, and it can be a strain on their work and social life. So the treatment approach for IBS can vary depending on the root cause of the IBS or what caused the IBS to initially begin. But initially, the main treatment approach starts with optimizing the gastrointestinal tract microflora. And what this means is optimizing our gut health, really working on the gut microbiome. Usually this can be done through the use of pre and probiotics. For those of you that may not know, probiotics are the good bacteria that we need in our gut. And probiotics can be found in certain foods, such as kimchi, sauerkraut, tempeh, miso. They can also be found in supplements or in a pill form. Now, prebiotics are what the probiotic bacteria feed on to grow and thrive. And prebiotics are these fiber foods that can also be found in a supplement form or in food form. So a combination of pre and probiotics works really well together. You're putting the good bacteria in your gut, plus you're giving them the food that they need to grow and thrive. Treatment approach also involves normalizing our bowel habits. So reducing the constipation, diarrhea, any type of bloat, gas. And this could be done through the use of dietary fiber or eating more fiber-rich foods, providing adequate hydration and fluids, and sometimes increasing exercise and physical activity can really affect our digestive system as well. And again, managing the symptoms, whether it's abdominal pain, bloating, some people even experience straining when they're having a bowel movement. Supporting the nervous system can also be used in a treatment approach, and using certain herbs, supplements, and adaptogens can help with supporting our nervous system. Decreasing inflammation in the gut through the use of certain nutrients such as licorice root, chamomile, turmeric, and peppermint. And lastly, assessing and managing food allergies or intolerances. And this can vary for different individuals and may not be a cause for certain individuals, but oftentimes things like gluten, dairy, and FODMAPs have been shown to cause these symptoms for individuals who have a sensitivity. So now we'll talk a little bit more about what FODMAPs are in case some people aren't familiar. So a low FODMAP diet is very commonly used for treatment or for helping reduce IBS-related symptoms. So FODMAP basically stands for certain types of sugars or carbohydrates that are found in our food, and a variety of different fruits, vegetables, legumes, nuts. And during a low FODMAP diet, the goal is to go first through a 6-week elimination phase where you eliminate all high FODMAP foods. So this is giving your digestive tract a break from eating foods that are triggering likely. And then this is followed by a reintroduction phase that can take anywhere from 8 to 12 weeks. And the reason why it takes a long time to reintroduce foods back in is because our goal is to reintroduce them back one at a time so we can monitor and see if the symptoms return or if there is another IBS flare-up. Eventually, the goal is to reintroduce all foods back in and distinguish which foods an individual still cannot tolerate or which ones they're able to digest more properly. Okay, so to summarize a bit what we talked about, so as we mentioned, IBS is the most common gastrointestinal disorder in Western countries. The root cause of IBS can often be hard to determine, but some of the common root causes include low-grade inflammation, altered gastrointestinal mobility, or dysbiosis. Before diagnosis of IBS, it's really important to rule out any other gastrointestinal tract disorders, such as Crohn's or ulcerative colitis that we talked about. There are certain risk factors for IBS, which include familial disposition, acute gastrointestinal infections, history of antibiotic use, and traumatic or stressful life events. Now, lastly, it's really important to look at IBS as kind of an umbrella term, and I'll explain what I mean by that by using this graphic here. So The reason we can look at IBS as an umbrella term is because there are so many different conditions that fall under IBS or can be a contributing factor to IBS. So things like gluten sensitivity, lactose intolerance, SIBO or small intestinal bacterial overgrowth, food allergies, GI inflammation, fructose intolerance. So we can see that there's not just one contributing factor to IBS, but there's so many other ones or several factors that can develop IBS. So that's why we refer to IBS as kind of an umbrella term. Some key takeaways. So first, it's important to know that the root cause or causes of IBS may be different for everyone, right? So not all individuals have the same reason for developing these symptoms. It's important to create your own timeline based on the onset of your symptoms. So thinking back to when did these changes first start? When did your stool frequency change or your bowel movement frequency? And it may have to do with some of the factors we talked about, such as if there was a period of chronic antibiotic use, or if there was a significant traumatic or stressful life event that occurred at that time. It's important to listen to your body's signals and cues. So the body's always communicating with us. It's telling us if something is wrong. And if we ignore those signals, they can progress and become more chronic over time. Remembering the gut-brain axis and the connection between our mental health and our gut health and our digestion. And if you're interested in learning more about the gut-brain connection, and if you're interested in knowing whether or not you have IBS, I would recommend talking to a functional nutritionist rather than a general internist or a dietitian. And the reason for this is because a functional nutritionist can really do a comprehensive assessment and order specific functional medicine testing to help determine the root cause of your IBS, and that's where the treatment begins. If you're interested in working with me, you can schedule a personalized nutrition consult by contacting us at contact@pacificintegrativepsych.com. Okay, so do we have any questions from anybody? You can either put your questions in the chat, or if you feel comfortable, I encourage you and welcome you to turn on your camera and your audio. You can use the raise your hand button and I can call on you. But if you don't, you're welcome to put your questions in the chat and I will get to them shortly. So one question I had was, how do you determine the difference between IBS and SIBO, or small intestinal bacterial overgrowth? And this is a really good question because the two can often be very similar. So for example, in the case of SIBO, individuals experience changes in their digestion, they experience constant bloating, certain digestive issues. SIBO is tested through a breath test. And this test can produce some false positives or negatives, so it can be a bit tricky as well. But a lot of times the two can be related as well. So if an individual has SIBO, they may also have IBS, right? So because of the what the gut goes through the treatment of the SIBO and the use of certain medications, especially antibiotics, later on that individual can develop IBS. And that's why the two are very related, but it's important to distinguish between the two by doing some of these tests ahead of time to make sure that we're treating the right condition. Any other questions? All right, and for those of you that joined us a bit later, this presentation is recorded and you'll get a link with a complete workshop sent to you afterwards. You're welcome. Okay, all right, if there's no more questions, then thank you everyone for attending. We'll have another workshop next month. It's going to be on the 4th Wednesday of October, and I look forward to seeing you all there.